And here she is, Alicia Smith.
Hi, I'm Alicia Smith. I'm the Marketing Communications Manager for Apuna Pima Cape York Health Council. Firstly, I'd like to acknowledge the traditional owners on the land on which I stand today, and I would also like to pay my respects to the elders past, present and future. So for some background, Apuna Pima is a membership-based, community-controlled Aboriginal health organisation responsible for delivering high-quality, culturally appropriate, comprehensive healthcare to 11 Cape York communities. So Apuna Pima emerged out of a health conference held in Projinka Wellness Lodge in Injinu in 1994. So in the 2 decades since the inception of Apuna Pima has grown from a small advocacy organisation to one of the largest Aboriginal community-controlled health organisations in Queensland. Now, I'd like to thank the EMPA for the opportunity of presenting the Apuna Pima approach to COVID-19 response. Now, I'll be going through communication strategies that worked well and why, the challenges, the barriers we came across, and some lessons learnt throughout. Feel free for any further clarification in the Q&A. So Indigenous communities around Australia were among the most threatened of COVID-19. One of the main reasons being the higher rates of other health issues within those communities and the devastating impact COVID-19 could have on those people and the community. So Aboriginal community control health organisations are known for great population health strategies. Therefore, when the realisation appeared of COVID-19 hitting vulnerable communities of Cape York, swift action was taken by the leaders of those communities and our organisation to ensure the safety of the people of Cape York remained paramount. And the result of no known cases of COVID-19 in Cape York is from great, clear, decisive leadership from mayors and councils in each community of Cape York. Now, previous health promotion projects and other critical incident approaches and responses have helped us understand the importance of early community consultation and how doing this early on will help set up effective communication strategies. So I'm really going to elaborate on why that's important. So the early consultation within this response led to quick, decisive action from Cape York mayors, as mentioned earlier, as they were aware of the impact COVID-19 could have, and that's come from consultation. So our communication strategies led us to publishing informations to communities well before other organisations. It also highlighted the importance, as it also helped us ensure we understood the information that was needed in a community setting. So what did they need to know? What didn't they need to know? And how were they feeling about it all? It was very different in a community setting opposed to an urban setting. We ensured our senior management team, particularly our CEO and Dr. Mark, our public health medical advisor, were at the table with mayors and councils early on with guidance and advocacy. We ensured our community staff knew everything we did. So when they felt empowered to help their own communities and they had the information to do so. We published information in language where possible and appropriate. And with those consultations, it also led us to how we were to roll out our strategies. So what the community wanted to know and where they wanted to see it. But it also highlighted the barriers in which the communities were feeling and the challenges that we were going to have addressing those. So I'm really going to talk about this just to give you some context on why particular strategies in camp and the campaigns we used in our response were the way they were. So one of the first barriers was people underestimating their personal risks. So some community members felt that there wasn't a risk to be had as the virus wasn't near them, because at the beginning, there wasn't much. It was down south. It wasn't even in the outskirts of Cairns or local cities. We also heard community believing that Aboriginal Torres Strait or Torres Strait Islanders were safe from the virus, as they had there wasn't much media at all around any Aboriginal or Torres Strait Islanders being infected by COVID-19. So we also had that to combat. There was also people avoiding messages altogether due to fear or just because they're underestimating, they just were avoiding it all together. Now, this is something I think everyone would have felt, not even just in a community setting. So it's not unique to a community, but something we still needed to address is oversaturations of messaging later on in the response from multiple resources, causing confusion or just overwhelming of information. And so people then avoided messaging. There was also messaging from other resources, for instance, the government or not local councils or local governments that were either not practical or relevant in a community settings. Now, to give you some more insight into that is quarantining, we were told by the government, if there were to be a case in community or in your household, in your household, you should quarantine in a different room and with an ensuite so you don't have the chance of infecting anyone else. Well, this isn't practical or relevant in a community setting. It's very rare to come across a house with an ensuite. So we need to ensure that we were articulating information in community settings that understood on how they can deal with it should there be an outbreak in their community. There was also the frustration and confusion around the constant changes of restrictions on the way they accessed their health, on the way they even spoke to their family and had their cultural protocols change. So we need to be ahead of that and understand that, because we were a source of information for community. So we need to be ahead of it and understand it. And that's even down to the rapid introduction of the Biosecurity Act. This obviously changed how we did business we have a lot of FIFO staff, so we need to understand it. So when community were wondering where we were or why we weren't there, we were well versed of the information. Now, another one that was a real tough one, and it's probably the last one I'm going to highlight today, is the fear from community around the escalation of domestic violence or mental health challenges within a family setting during these unprecedented times. So Dr. Mark, alongside our social and emotional wellbeing team, understood the risk of isolation and what it could have in a community setting. So they and the Puna Pima team ensured they were continually actively engaging with community and addressing different mental health stuff or ways to manage your time and your emotions during COVID-19. Now, once we had a rough guide on what we really need to put together and what strategies we went on to the following strategies, which I'm going to talk about now. But I really want to highlight community consultation did not just stop at the beginning. It was something that continued throughout the campaign and the response, because particularly with COVID-19, things are changing consistently. So we really need to always have our finger on the pulse as to how community felt and how we were to address it. So one of our main campaigns or main strategy was around our advocacy on a local, state and national level. So we had Dr. Mark, a well-known respected doctor, Dr. Mark Wenatong, lead that advocacy, but not just on behalf of communities, but on behalf of all Aboriginal and Torres Strait Islanders. And it was this was in processes, policy change. This was around how we were to get boarding school children back to home for safety. This was just purely showing Australia or all government on how we really need to be conscious of Aboriginal and Torres Strait Islander communities and the impact COVID-19 could have. So Dr. Mark was on national radio, TV, radio, on posters, on having multiple interviews, even globally, around the impact COVID-19 could have. We also did direct health promotion information. So that's just your posters around social distancing, hand washing, what COVID-19 is, and just different stuff like that. But one thing we really, I think, was a point of difference was our social emotional wellbeing material. We really saw that gap and we honed in on it. And a lot of our collateral really spoke of, it's okay if you're worried about COVID-19, but here's some simple ways to help you through that. We did frequent community updates. So these were video messages as status updates from Dr. Mark, just clearly stating no COVID-19, here's some tips. And every video was a bit different, whether he highlighted the flu shots, highlighted social distancing. It was just something, he was a well-trusted man, well taken up those community updates. Now, we understood COVID-19 was a global pandemic, so it was something we couldn't address by ourselves. We linked in with national campaigns, firstly, the National Mental Health Commission in this Together campaign, and Boost Your Healthy during COVID-19. We also, going back to the mental health stuff, we opened a 1-800 line for after-hour calls to our social and emotional wellbeing team for community members to access when they needed to. It was another channel, another thing to show community reassurance in tough times like this. They could access that number when they needed to. Now, we also wanted to share some positives. So within COVID-19, so we started a campaign, Our Health in Our Hands, and it showed tips and tricks and lots of positive stuff around COVID-19 shared by professional footballers and singers and authors, and most importantly, our staff. And these were down to how to manage your hair, to fitness, to how to interact with your kids at times, like going old school with hopscotch and puzzles and different stuff like that, and even down to mindfulness tips. We created TikTok videos for our younger demographic, and it was great. It was so well received, lots of fun to do. We just did a health twist to it about washing your hands. We ran the campaign Stay Home, Stay Safe. Now, these were simple 2-minute videos explaining basically what we did in posters, but in a video content. So social distancing, hand washing, how to communicate to elders while remaining distant, and simple stuff to manage your health. Now, we wanted to ensure our information was disseminated in an appropriate way. So whether that be through participating in communication, participating with other community notices, so your newsletters, through other people's social media, through their pages, through particular community groups, lots of different ways. But we also, with it came to our print, we had our posters in schools, councils, hospitals, workplaces, home fridges, even down to people's fences. We had some of our at-risk posters really taken up by the community, and they were simple: stop, I'm at risk, please don't enter. They were at front of a lot of different houses within community. We had TV screens, which were taken up really early on the mark because the print was a bit overwhelming near the end. So these were just our posters, but on screen, radio announcements, interviews, and where possible in the early stages, community gatherings or meetings. We ensured that someone was at the table. TV shows and consoles at hospitals. And lastly, social media. We ensured we were on multiple mediums of social media. Now, we really wanted to make sure our information was reached to the wider community, because we understood that not everyone is in one location. It's a very transient community. So we ensured that there was boarding schools near the information, prisons, juvenile detention centres, hospitals are outside of Cape York, and displaced families in Cairns or outskirt areas too. We really ensured that that information was out there. Now, lastly, lessons learnt. Our general posters around COVID-19 worked well in the first instance. However, as the campaign went on, they were part of the noise. So we really knew that we need to switch it up. And so that's something that the consultation really highlights to you, that you need to flip things to videos or to a different medium. Our community updates, they were great, and Dr. Mark was well respected and he was well known. The only lesson learnt from that was that if we weren't consistent with timing, we were hearing from community that there was a sense of concern if we didn't update regularly. Why isn't Dr. Mark telling us anything? Should we be concerned about stuff? So consistency is key. Also, your biggest influencers don't need to be those who are famous. Our biggest interaction with our campaigns were those of our staff, and that's our community as well. Sharing heartfelt messages, they were genuine. So that's something that really rang true and something that we'll be implementing across all our campaigns. Now, translating information into a community setting is so important, and using language though, where appropriate and where you can, but ensuring it's applicable to each community. Each community has a different cultural protocol or community language. So we really need to ensure we had an advisory group that helped us disseminate information appropriately and culturally appropriate. And lastly, always be frank with your community messaging. Dr. Mark really made sure that this was the case. He shared his concern, but he also had he said the reality of COVID-19 with no hidden messages, and community really responded to that. Now, that's all I have time for today, but please ask any further questions. I really hope you've got something out of our presentation. And lastly, thank you again.
Here we go, stand by.
Thank you so much, Alicia. And now, hopefully, we're going to switch to you live to answer some questions. Alicia?
Hi, how you going?
Love it when a plan comes together. Lovely to see you. That was a lot of work you did. What resources did you have for all that consultation and production of product? How many people on the team?
Well, in my marketing communications team, I do have 3 staff alongside me, but it wasn't just my marketing communications team. Our organisation is 250 plus staff. And they all played a role in this communication response. It was something that we needed to unite on and work on. So that's down to even our groundsmen and community. They all played a role. And whether that be someone in the organisation that was helping design the posters, or it was just consulting on what's the best to go on those posters, or the community played a role as the consultation phase as well, having to talk to the community themselves, talk to their family. They fed into that type of stuff. So everyone played a role. There's no key team that were the main one. I think it's really important to highlight we all had a part in it.
I have a question from the audience, which is quite specific, which is, was there good take-up on the after-hours call line? The person asking says that they have a call line, but only during the day, and wondering if it's, how valuable did you think the after-hours call line was?
I had a feeling this was going to be asked. I don't have specific details in terms of data or anything like that, but from my understanding, it was utilised. We didn't utilise it across all communities due to there was other access for other providers doing a similar thing. But from where it was accessed, we heard there was really good reports. People took up on it. At this stage, there hasn't been discussion where we would go forth and always have that. But I hope that answers your question. It was really positive for the time it was in, but I can't tell you how well it was taken up there's nothing really to compare it to. But from what I've heard in community consultation, it was just having it there was a positive, knowing that they had the option to call if they needed.
So you mentioned oversaturation. What was the most, and I think all communicators in the COVID-19 space have faced this or are facing this. What was the most useful solution for you when you were communicating to your people?
It would have to be our community updates. Our general videos, we moved from more of a print base to a video base, and we found for our audience of Cape York, that was more of an interactive method to get our message out, particularly when it was Dr. Mark Wenatong. When he had those voices, it was a voice of reassurance. His face was well known and community took to it really well. And it wasn't just on social media, I mentioned in the video, but we did put this on TVs in the screen. We shared it USBs in the community health centres. There was a range of ways, and we sent it via links to lots of other organisations. But we found that was the best way to combat the oversaturation. It didn't eliminate it, obviously, but having a video and reinforcing messages we may have done in other ways via that video really helped combat that.
That was a really interesting reality check about the ensuite and, you know, the cultural relevance of those sorts of general national messages. Has there been an opportunity, or do you think there will be an opportunity to feed some of that back? There's a lot of people in Australia who don't have ensuites.
Yeah, there is a bit of feedback going on, I believe. Our overarching body is looking at putting some feedback towards. I think there's an inquest. I'm not too sure. I can't confirm. But I think we are having the opportunity to feed that back. And that's something that we have all addressed within our COVID response critical incident management team, is having that opportunity to feed back, particularly for the First Nation people, on what weren't appropriate or didn't work for us and how they can improve. So yeah, there will be an opportunity from our understanding. We're just collating all that information. I can't give you specific on what it is, but I have heard there will be an opportunity for us to feedback.
And this question probably links. The Department of Health produced a series of resources for COVID. Were these used at all? And how does the federal department ensure that resources are appropriate for your communities?
So there is different governing bodies that did create stuff. So we had DATSIP, and there was Quake, which is our Queensland governing body for Aboriginal health. They created resources, and I worked with Queensland Health. We worked alongside each other with stuff. So they had Urban Institutes, another organisation that created stuff on behalf of Queensland Health, and they were readily access to the community, and that's something that we would still put out there if we found it was appropriate. I suppose what the difference for us, or point of difference, was for our organisation was purely our brand. So they knew the Apuna Prima brand. They were comfortable because we're a community controlled organisation rather than having Queensland Health on that brand. So because we have a health action team, which is a governing body, which is community run, that feeds into our organisation and how we do our work. So having that reassurance with our name on it, knowing that there has been appropriate consultation to whatever we created. But there's particular stuff that we still shared as we found they were useful, and the community voice that they were really great, and they had some videos, some animations we did use.
What feedback, have you had time to collect feedback? And if so, what feedback have you got from the community about how they felt during this COVID, the initial stages of the COVID response?
I haven't been involved in too much feedback personally. Our social and emotional wellbeing team are doing some reflective methods now, going through on how it's going. From initial discussions we've had, is that they're in a very different stage to us, particularly because we're based in Cairns, a regional area, and they're rural. So even for our staff that are FIFO, we're experiencing different things to them because we're not under the Biosecurity Act. So there's definitely a difference in frustrations from community we're hearing now that we're not experiencing because we're being told Queensland is open where it isn't, in fact, in Cape York. So from that, we understand there's still frustration, but of the overall COVID response in terms of what's happened so far, we're still collating that information.